I'm Dr. Peggy Knudson. I'm the Medical Director for the Military Health System Strategic Partnership with the American College of Surgeons. One of the biggest challenges is that when military surgeons are deployed, they are taking care of severely injured patients. When they come back to the United States and into what's called their garrison practice, they're often not doing any type of trauma or critical care. They're doing elective surgery, sometimes very low volume, where they're assigned. So they're not trauma ready necessarily, and that's a big challenge. A second challenge for them right now is the repeated deployments. The military overall has a severe shortage of surgeons, so the surgeons that are in the military are being deployed multiple times, taken away from their practice, taken away from their families, and so they separate from the military as soon as they pay back their time, and that leaves the military quite short of surgeons. The idea of the integrated military civilian trauma system came out of the report from the National Academies of Science, and that was a report that was commissioned by the Department of Defense along with the American College of Surgeons. And the report says that the best way for us to keep the military ready to be deployed and to enhance our trauma system within the United States and keep us ready for disasters and mass casualties is to integrate the two systems together. So during the Iraq and Afghanistan conflicts, the Department of Defense set up an incredible joint trauma system that goes with an injured patient all the way from Iraq to Germany and back to the United States, tied together with a complete registry, tied together with video conferences on a weekly basis so that the knowledge can be shared across all treatment facilities that involve the care of this particular patient. Also, they have a whole series of clinical practice guidelines that they developed for the conflict. It's about 48 of them actually. All of that would fall apart if there wasn't a way to preserve that when the conflicts wind down. So the idea of keeping this going meaning that we have a complete unified trauma system, whether you are in a civilian center or you're in a military treatment facility within the United States, so that this whole concept is preserved and ready to go the next time there's a conflict.